Nisayandra Vinaka, a very good morning to you all. Esteemed members of the Fiji Medical Association, healthcare professionals, sponsors, and invited guests. I would also like to begin by acknowledging the landowners of Suva, of Nandanumai, where we stand on today, and acknowledge their leaders, past, present, and future. I must say that I stand before you with deep, deep gratitude as we gather under the vital theme of future-proofing healthcare standards in Fiji, accountability, ethics, and innovation. And let me begin by commending the Fiji Medical Association for organizing this critical dialogue, one that could not be more timely as we confront the evolving health challenges of our people. This year's theme challenges us to reflect on three key pillars: accountability, ethics, and innovation. For Fiji's women, elderly, people living with disability, and children, most often the most vulnerable and disproportionately affected by gaps in healthcare, these are not just gaps. These concepts can represent lifelines. They're deep connections between health, dignity, and social justice. The well-being of our people depends not only on treatment, but on systems that empower and protect. So when we speak of accountability, we must ask, are we tracking maternal health and infant mortality with urgency and transparency? Are we recognizing and treating gender-based violence not only as a societal failure, but also as a public health crisis? When we speak of ethics, we must ensure that care is provided with dignity, free from stigma, whether to a mother navigating postpartum depression or dealing with HIV transmission from mother to child. We must raise awareness, train frontline workers, and create safe spaces for most vulnerable to seek help without shame. And innovation? In today's world, it's not just about technology, but about reimagining systems to serve the vulnerable. It's about inclusion, it's about anticipating needs, especially for those whose voices are rarely heard. Earlier this year, I had reached out to Dr. Alipathe Vakamodea to request Fiji Medical Association to help with outreach and education on these very critical issues. And today, I'm beyond grateful to see some of these come alive at today's session. So I can't say thank you enough. As you are aware, that highest suicide rates in the past 3 years have been among our senior citizens. Aging is something that is very poorly understood. Most people who age struggle to adapt to changes in their physical abilities. We are a digital generation, and too many people lose patience with our aging citizens, leaving our elders neglected. So we need a conversation and education on geriatrics, and I'm thankful in this seminar that Dr. Rufina Ratumaitavuki will pick this very needed conversation. I hope this will lead to greater awareness and education on aging process. I was asking Dr. Alipathe, how do we create this awareness on a regular basis in media so that people begin to understand some of this? So I'm glad this conversation begins today. As we look at increasing number of child abuse and child neglect cases, I realize that as a nation, we do very badly in identifying and supporting cases of postpartum depression among our mothers, an issue we stigmatize our women with. So I'm very hopeful that conversation today will lead us to identify and better diagnose and support women with postpartum depression during postnatal clinics. I'm sure it is very possible. Currently, we do not have data on postpartum depression. But we know that global data locks it around 20% of the population. Do we have similar data? What happens to these women who are suffering? Could we collect data to develop better policies to respond to this challenge? We look forward to hearing insights into postpartum depression from Dr. Violet Aracito and understand how this mental health issue affects a woman during one of her most vulnerable times and the devastating impact it leaves if unaddressed on mothers, children, and their families. There are not enough women in leadership positions. So when I've been going around asking women what stops them from putting themselves up, for these positions. And during my conversations, I came across many women who shared that time when they're about to get into leadership, they seem to lose confidence. There's a lot of self-doubt, seemingly in the age group of 45 to 55, when they're in prime for leadership. And in conversations, we found some of the women shared that they realized they were struggling with menopause. There is little conversation around this subject. Some women shared in Nandi, in a few conversations, that they had to access hormone therapy. But not only menopause, women struggle with fibroids, endometriosis, and other reproductive health challenges, often misunderstood and undiagnosed. Some of these health challenges are not easy to diagnose or treat in Fiji, but awareness and conversation around it could certainly help. And when I heard women articulating about difficulties around these issues, it made me realize that both men and women do not understand the hormonal changes that happen as we age, causing different symptoms, including lack of interest in intimacy, which could be a contributing factor to our increasing domestic violence, as accusations fly of waning interest in relationships. It could be just biological and needs conversation and understanding. So thank you for picking up this conversation, and we look forward to hearing from Dr. Lithe about the link between GBV and menopause. Accountability means integrating GBV screening into routine care and responding compassionately towards victims of GBV. By the way, even lesser talked about is male menopause, or hormonal changes in men. The midlife crisis often hits our men also between the same ages, 45 to 55. Though medically known as andropause, I'm sure all of you know that, androgen deficiency in the aging men. I wonder why we're not talking about that as well, because that can also, as men gradually have decline in testosterone levels as they age, and both men and women going through hormonal changes certainly puts strain on relationships. So hopefully there could be research around that and conversation around that. I know very difficult, but I wonder what is the relation to the family violence that we see. Sadly, we have a crisis emerging with HIV transmission. We need to hear from Dr. Miriama Thegard and Dr. Darshika Balak to help understand the pediatric HIV in Fiji. How our children are being impacted by the transmission, and how we need to strengthen antenatal care in order to stop mother-to-child transmission of HIV. There has been a lot of focus on young people and drug use, injectables, but we have not paid enough attention to the impact it has on family, and more now on children. And the numbers are causing a lot of concern. These are not isolated issues, and some of these issues are examples of how the fibers of a community are fraying and further negatively impacting the health of our people. So I had these two asks of FMA. I know you always had your CME program, so I was requesting inclusion of these topics in your continuous education, so referral pathways could be developed for specialized care for these concerns. I'd like to appreciate all your efforts in reaching out to the World Medical Association to develop further strengthen your CME education program. And I urge medical professionals to please make use of these modules to stay abreast of ever-changing world. Second ask I had of FMA was to help educate us. There's so much knowledge in this room. Is it possible to run podcasts or education series on these very important topics? I'm sure you'll tell me you're busy, and some of you don't like to come to the media. So how do we develop this, in some time? Can FMA run podcasts? Can we evolve programs using media? Because unless our people know what's happening and the challenges you are facing in the clinics, in surgeries, then we are not empowered. So I'm hoping that it's something that you could help us with basic awareness on this very important issue. I hope some of you will be willing, and hope FMA could pull it together with some support that we could help find. Doctors play a very pivotal role in our society as you serve as guardians of health and well-being. With your expertise, compassion, and dedication, you help preserve and restore the health of individuals in our communities. You are educators, advocates, healers, making a profound impact on the lives of your patients and the overall fabric of our society. You go beyond your call of duty. My question to you is, how do you carry the load of care? Are you creating spaces for your own health and rejuvenation? Everyone looks up to you, so I'm sure it's difficult for you to seek help, especially when you deal with constant burnout, having to deal with traumatic cases on a regular basis. But you are human as well, and we have seen around us many friends who the stress had taken its toll. So maybe my final ask to Fiji Medical Association today, I had a wish list for FMA, is to ensure the well-being of your team, including emotional and mental support programs. And I'm sure that's even harder for you. If I told a doctor to seek mental health support, you probably will hit me with something on my head. So I'm wondering whether FMA can create events, golf tournament for doctors, hikings, picnics, sporting, to help let off some steam. Because you can't continue to pour from an empty cup. So FMA, I wonder if there could be surveys done on what self-care looks like for doctors and plan for care and support. Because I'm sure all of us know doctors who struggle with the emotional, mental support, with work, with family. And I'm hoping that that care is also looked at, focused on. Future-proofing of healthcare is not a task for doctors alone. It demands collaboration from all stakeholders, from government, NGOs, development partners, faith-based organizations, and the communities we serve. Together, we must rebraid the fibers of a society which have long made Fiji a resilient and compassionate nation. We need prevention strategies for malnutrition, lifestyle diseases. We need care and compassion for those struggling with mental health challenges, care for sick and elderly, and the society at large needs to play their part in this regard. You are looking at inside at the clinics, but I'm hoping that we can rise as a whole country. So to Fiji Medical Association, Vinakavakalevu for your leadership. We look forward to working with you to carry this conversation forward, especially on the very sensitive issues that you're speaking about today. And I know that you're carrying on these conversations internally in these workshops, but how do we create it at a national level, these conversations, but also how do we support the systems? To our sponsors, including the Fiji Care Group, your continued support makes this work possible. And to every individual here today, your dedication, your knowledge, and your compassion are the foundation of a healthier, more just Fiji. So as we leave here, at the end of the day, not just inspired, I'm hoping that we are ready to turn this dialogue into action and vision into reality. I'm really looking forward to conversation for half a day, and I'm trying to see how do we connect some of the dots with our community. So wishing you a very wonderful conversation, and well, it's not that wonderful actually. The stats are quite scary, but I'm hoping that we'll have a productive day and wish you well for today's deliberations. Vinakavakalevu.